Hello, I'm Maria Hall-Brown, and this is LA Currents. Coronavirus, COVID-19, non-stop conversations, worldwide concern, and never-ending changes. There's a fine line between hysteria and solid information. But today we have some wonderful guests with us who are going to give us some solid information when it comes to how Los Angeles is preparing and is prepared. I'm delighted to welcome to this wonderful stage Aram Sahakian. He is the General Manager of the City of Los Angeles Emergency Management Department, and Joanne O'Brien, the City of LA's Personal Medical Services Administrator, and I also want to mention that you are an RN. So thank you both for being here today. So on March 4th, Mayor Garcetti actually issued an emergency, a local state of emergency. That sounds very dramatic, but frankly, that's more complicated than it sounds. A lot of things get put into that whole thing. So what exactly happens when there's a state of emergency called, and who's involved, and what are the agencies, and what is starting to happen?
Absolutely. First, thank you for having us. It's extremely important for us to communicate with the public, for them to understand what we're doing to prepare. So an emergency declaration gives us the tool to better coordinate and obtain resources that are needed. It doesn't mean that we hit the panic button. It doesn't mean that we're scrambling. No. It puts the resources within our Emergency Operations Center. It gives us the tool to bring in all the city departments and agencies together. It gives us the resources to ensure that our first responders on the first line have the personnel resources, they have the financial resources, because once you declare a state of emergency, you become eligible for reimbursement too, for the money that you're spending. And as you know, also the state of California declared a state of emergency. So it brings us all together to better plan for this incident.
Now, when you're working through the preparation plans, are you looking at other states, other cities, other countries to see how they have been responding and reacting to this?
Absolutely. Absolutely. We have a team, as a matter of fact, studying what other countries are doing. I'll give you an example. When it comes to schools, Singapore has a very robust plan they're putting together. So we look at the good practices, it's all lessons learned, and then we huddle together and we ensure that our plan is the best plan possible.
So you mentioned a few of these things, but beyond the medical concerns, obviously, people sharing the virus or getting the virus or having to deal with the virus, what are some other things that are a part of being a prepared city? I mean, is there, the economic impact, the business community, social gatherings, that kind of thing?
Well, first we need to ensure continuity of government. So the first thing that our Mayor Garcetti, did is to issue a directive to all department heads to ensure that their continuity of operations plan is well prepared, for them to review it in perspective to a pandemic scenario, to add an addendum to it if needed for COVID-19, because continuity of operations of city agencies and departments will ensure continuity of government and will be able to assist our constituency, Angelenos, when we need to. So that was the first step that we took. Yeah.
Well, obviously, Los Angeles has a an enormous amount of population, but also, a very diverse population, and we have an enormous homeless population. I mean, what is happening when you come into scenarios with, the unhoused or other fragile groups that might be in limited resource opportunities?
So our UHRC, our Homeless Response Center, has been activated not only for this situation, this incident. It's been activated for a long time now to address the homeless population, because as is the homeless situation is an emergency. That's the way we look at it. Right. So they are embedded inside our EOC, and they are putting plans together, and we're getting them in touch with other states, other counties, to see what others are doing. Again, lessons learned type of scenario. They're in touch with county health. They are visiting the bridge homes to ensure that the proper hygienes are in place. So they're taking every measure to ensure that the homeless population also is part of the equation, which they are. They're part of us. And it's not just them. It's also the senior population, the vulnerable population, the disabled. So all the vulnerable population is part of all this planning.
You know, Joanne, before we actually started talking, you know, that's one of the issues here is that it's not the regular flu. As much as people want to kind of compare and say there shouldn't necessarily be this heightened attention on it because more people die from the flu, it's the issue that we don't know enough about this virus yet to determine even whether certain populations are indeed at risk.
Correct. It's new to us. It's new to science, where I think the science industry is trying to catch up to it. We're watching it. We don't know exactly. We started out saying it's 14 days now in terms of being contagious, might be 27. You might have symptoms, you might not. So I think that's why we're asking people to do social distancing. This is a time where you don't shake hands, don't go into large crowds. Be a good hand washer, not just rinse. It's for 20 seconds. Don't forget about your thumbs.
Happy birthday twice.
Happy birthday twice. Don't forget about, you know, in between your fingers, your fingernails, your thumbs. So hand sanitizer is good, but it doesn't take the place of old-fashioned, you know, soap and water.
Okay, so I'm actually going to pull out some props because, you know, there's been a run on toilet paper, which is very odd, I think, but there also has been somewhat of a run on different sanitizers. Okay, so this was something I found that I thought was interesting. Right. This is, I don't know if you can see it, antiviral Kleenex. Says it's going to kill any virus within 15 minutes of use. How do we feel about that kind of thing? Do we think that that's something that we should have? Obviously, we got our Lysol wipes, we've got our hand sanitizer, over 60% alcohol, which apparently is an important thing. I've heard about hydrogen peroxide being part of this whole thing. Antibacterial hand wash, and then little wipes.
I'll start with the Kleenex.
Okay.
I think any Kleenex is good, and when you sneeze and cough, don't sneeze into your hands. Use a tissue.
Right.
Then throw that tissue away. Then wash your hands.
Right.
So any tissue will work.
Okay.
So that ends that.
There you go.
About hand sanitizer, it should be at least 60% plus of alcohol.
Right.
At least.
Right.
But it doesn't take the place of washing your hands with soap and water for 20 seconds. It's good when you're out and about, you're at the store, you just touch something. You want to wash your hands right away with the hand sanitizer.
Sure.
That's good, but when you get home and you have access to a sink with soap and water, then wash your hands.
Why is soap and water I mean, because this is a lipid, why is this?
Because what you do with soap and water, it's not only the soap, which kills most of the bacteria and viruses on your hands, it's actual friction. So that's why it's important to do the happy birthday twice, you know, for 20 seconds. And the tops of your hands, your thumbs, people kind of forget they just do this, but you got to do a thorough job. Don't touch your face, for sure, because if your hands are contaminated, have something on them, and you touch your eyes, your nose, or your mouth, you've potentially infected yourself. So it's really hard. All of us touch our face hundreds of times a day without even thinking about it. So it's something you have to think about, not touching your face and washing your hands. If you do those simple things that we as individuals to keep our community safe can do in terms of stopping the spread. And then if you're not feeling well, stay home. I mean, all of us have been guilty of, we're gonna power through this, we can do it, but this is not the time to do that.
Well, I'm going to actually jump to something along those lines, because as employees, we now have rights that employers are being educated about in regards to staying home. And so is that part of an official policy that's going into place about employers should not necessarily require doctor's notes? Employers should, you know, have more understanding of, you know, their responsibilities for their employees?
Employers should not create a situation to make an employee feel uncomfortable to report to work, or complicating the situation by asking a doctor's note, you know, immediately or 2 days after their absence. They should help the situation because it's an unknown, and the experts are making clear recommendations that sick people make sick. So stay home if you're sick. even if it's not the COVID, even if it's the influenza B or any other sickness, stay home. So whatever we can do as employer to assist that, we need to support it. And of course, part of the coup plan of every department, every business, and we're communicating with the private sector also, it's not just city agencies we talk to, is to look at their critical functions and ensure that they provide telecommuting for non-critical functions. So they will lessen the possibility of the spread by keeping people home.
What about confidentiality issues? About, the word about someone may be ill being home. Is there some sort of policy in place for employers in regards to confidentiality with their employees?
The HIPAA laws apply no matter what, which is the Health Information Portability and Privacy Act. So we want to make sure that we're not sharing this information with everyone else, because someone may be quarantined or sent home by public health, but nothing's wrong with them. It's just in the event to err on the side of caution, but only those individuals that need to know will be contacted and sent home. So it's not something you should or even share with anyone else in the workplace.
And beyond the medical concerns, I know that there has also been a huge outcry in regards to how people behave towards each other and how people are sensitive to the nature of this. I mean, it's obviously a very stressful time. I mean, I just was reading this great article about the psychology of coronavirus fear and how to manage it, and how not to overstate the obvious, but how not to treat each other badly because of this. How is all that being relayed from the city?
Well, another reason for the confidentiality. I mean, it's not a secret, stigmatization. You're seeing, all kinds of things out there that are not right.
Profiling.
Yes, even violence, we're seeing it. So absolutely, and that's one of the reasons for confidentiality. And what we're telling the public is that it doesn't have to do anything with that. It doesn't have to do anything with the race, with the color of who you are, right? So it is a sensitive situation. It's a concern of ours, and confidentiality plays a big role in this right now.
How prepared are we legitimately in terms of personnel, in terms of hospital beds, in terms of, over-the-counter items for people to, be okay, in terms of law enforcement personnel? How are we? How is the state, how is the city of Los Angeles right now in terms of ramping all of that up and making sure that hopefully none of it gets used, but if in fact it has to?
Well, it's being ramped up. I can guarantee you that. Every stone is being turned. As far as hospitals, that's a county health question. This is not new to our hospitals. They've dealt with other pandemics in the past and other infectious diseases. They are looking at their planning. They are looking at their coup plans. I know that for a fact. Now, capacity obviously is a concern. We're not there yet. Obviously, the numbers that you're looking at, truly what the county health is saying that, the regular flu is much more impactful than this. Having said that, there's an unknown here, and for that, we're all preparing, not panicking, preparing. As far as the city agencies, the same way, basically. We had an all-city agency call this morning. Every critical function, every department that has a critical function, police, fire, general services, we're on the call.
What about the incarcerated population? What about jails? Because you really, in areas, you cannot have that personal distance just because of the very fact of what they are.
We're screening at the city level. If we happen to have an arrestee that comes in that's exhibiting those symptoms, we've already been in communication with LAFD, who's going to transport that individual to a local hospital. So we've already had that communication when and if. One of the facilities actually has a negative pressure room, which means that particular room doesn't circulate the air through the rest of the building. So we can isolate that person, call the paramedics. The person's not acutely ill where they need to. We just want to get them out of the situation and to the right care, and we'll be communicating with public health. So we're sort of all on the same page as with LAPD, LAFD, and the medical staff in the jails.
What about testing? Because not everyone should get tested. And do we have enough test kits if necessary? Because I know that that's been a problem. And how is the pace of getting those opportunities to be tested ramping up?
Right now, that's really a public health question. But if we identify someone that we think has a potential exposure, we call them, they have access to the tests and the criteria to which someone can be tested. So it's this really good communication with the city, the outside agencies, the state, the county. We're all talking, on real time.
The capacity has exponentially increased from a week ago. It keeps increasing, more kits available. And there's other outfits, including the private sector, that are also being permitted to do the testing at this time. So it is being ramped up.
The whole communication component to this is fascinating because, you're dealing with a city in a large county, in a large geographic area, in the United States, which also needs information from around the world. So how is that happening? Is it happening in a fluid way, or is it, you have relationships with certain places and they have relationships? How is the communication so that you know that you're on top of the most current information so that you can share it with the population of Los Angeles?
So on the emergency management side, there's a protocol. We follow SIMS, which is the Standardized Emergency Management System, and we follow NIMS, which is the National Incident Management System. Unfortunately, we're expert at it because of the fires and incidents we've had in the past, but truly, LA is one of the best at it. So there's a protocol. If we have an issue, we receive a request, we go through the Office of Emergency Management, through the county steps it up to the state, and same way the state steps it up to the federal level. And so there's a channel, there's a loop that we follow. We haven't had any issues. Obviously, the health departments are bombarded by phone calls and issues and questions. So their hands are full, I can tell you that, but we haven't seen any breakdown yet.
And is there now open communication from a resource, how the vaccine, if in fact the vaccine will come into play within the next year, or what you can do to improve your immune system, like boosters I've been reading about and that sort of thing. Is that kind of information being relayed amongst these emergency teams as well?
There's daily calls between the CDC, county health departments. Everything's being discussed, yes. This is a global issue. That's very important to realize. We are not alone. I've never received this many calls from my colleagues in other cities as far as emergency managers on a daily basis. We're talking 15, 20 times. No other incident we've done this. So it's a whole community approach.
I'm not even sure that this question can be answered, but I'm curious, how many medical professionals do you imagine across the world are working independently to try to come up with solutions? Or, are we talking tens, hundreds, thousands of different laboratories across the world that are working in their own direction? Or is that even an answerable question?
It probably isn't, but I know that at the National Institute of Health and some of our top universities like Johns Hopkins, they're all working on it, all the top scientists. That I know, and the CDC. So it's being worked on. I wanted to just touch on your question in terms of the immunity and the boosters.
Oh,
and
absolutely.
I've read all sorts of very interesting things online, but this is a time to take really good care of yourself, and sleep is one of the best things you can do for your immunity. That's when your body rests. That's when your body repairs. So get enough sleep, drink enough fluids, eat good stuff. Your nutrition has to be really good. This isn't time for processed, junky food. Eat well, rest well, and manage your stress. This is a really stressful time for a lot of people. Recognize that, understand that, do what you need to do, maybe take a media break, talk with your family, call your doctor if you need to, but take care of yourself.
Well, one of the things I didn't bring in my little show and tell was, now I'm watching vitamins be labeled as immune boosters and that kind of thing. So I'm sure that there's a lot of things that people should not necessarily buy into. So do you have any, on the flip side of this, What are some
I
of the things that you don't think
know.
people should wrap their arms around because it's not going to
I still
matter?
just sit on the basics. Take good care of yourself, manage your stress, get enough rest, and eat well.
So what are some of the things that people should not be doing in regards? I mean, obviously you said no hugs, no handshaking, all that kind of thing. What are some other things that people should just be in their daily life aware of? We talk about doorknobs and
Yeah,
and
social distancing we talked about,
Seems
which means
really
you're not
mean.
shaking hands, you're not hugging. I'm a very touchy, huggy person, so I really have to think about when I see someone I know and not give them a hug or shake their hands, but don't do that. Just do the elbow bump. Stay away from people. If you're in a store and there's a lot of people around, back up. You know, instead of standing right next to that person in line, maybe back up 6 feet. Sort of keep a 6-foot distance. Try not to go to large social events. If there's something you need to go to, a wedding, a graduation, something really special, of course go, but maybe stand off to the side so you're not surrounded by a bunch of people. So those are just sort of the tips.
do we have a line though where we're crossing between good behavior and thoughtful behavior, and this is ridiculous, we're just taking this too far, and we're crying the sky is falling, and it may not be, and we need to be a little bit more temperate about it? Because I know there's a backlash. I mean, you probably are hearing it and seeing it and feeling it, where people are thinking that, no, this is just too much now. I don't want to hear about it. I don't want to talk about it. It's just over the top.
Again, I'm going to recommend, we're not the experts. County Health, they have expert doctors, they have clear recommendations, they have clear guidelines on their website, and we're following them. I'm personally following them. I'll give you an example. Last night, my grocery shopping was at midnight. I never go grocery shopping at midnight, but I was at Ralph's, it was empty. No one was there. Wow. I felt more comfortable. Usually, I go during the day, and it's packed. So a lot of it is also common sense things, but again, I'm going to point to the recommendations by the expert. We need to truly listen to them, and if we follow them, hopefully, this thing will get resolved quickly.
And given the fact that you're obviously really learning a lot about the virus and everything, what about the idea that the virus will not survive in warm environments?
The coronavirus, just historically, the ones we know of, don't do well in warm weather. Whether or not this virus is going to react the same way, we don't know. We're hoping that with warm weather, it'll dissipate.
Because it has enough similarities that it feels somewhat recognizable, but it's behaving so differently that we can't even project what it might do.
Correct.
Okay, interesting. And what about, I know this sounds a little alarmist as well, is Los Angeles prepared for a curfew or a quarantine? I mean, the entire country of Italy is on quarantine. Is Los Angeles prepared to take those dramatic measures to maybe have a curfew or something along those lines?
I don't think that we will get to that point based on what you're seeing, based on the way and the measures we're implementing to mitigate it. But if there's that big if, County Health makes such a recommendation, we will be prepared for it. Obviously, LAPD law enforcement will lead that operation. I don't know if you heard earlier, New York, I believe, they summoned the National Guard for some communities. The capability is there. It could be done. It should come down, and it will probably come down from the state level with assistance. If it's something that the professionals are recommending us to do, then yes, but that's not what I'm hearing.
Well, I'm glad you're not hearing it, because I think you'd probably hear it first. So that's really good. The other thing that I really wanted to ask is that this is, as I've said earlier, this is a constantly changing, ever fluid, never predictable scenario. So the best way to make sure that you have the most current information, that you have the most updated information, so that you're not relying on hearsay and happenstance and those things that do cause fear, stress, and bad behavior. What are some of the best ways people can keep up with what's happening in Los Angeles?
So the websites, the information that's being disseminated online, World Health Organization, County of Los Angeles have a website. Our department, emergency.lacity.org. You can go there and receive a lot of information. And if I may plug in Notify LA, if you don't mind, if you subscribe to Notify LA, and the way you do it, you text to 888777 the word ready, then you will become part of this database. When we need to reach you and communicate with you critical information, then we'll be able to do that. But you need to be subscribed to it. So websites of professional health organizations and emergency management and the cities.
So how often are those being updated? And then when you become a part of this, or these alerts that you can get, I would imagine it goes beyond the coronavirus. I would imagine it's fires and earthquakes.
Absolutely.
And everything.
Absolutely. Coronavirus is one page of many other pages on our website, and it's the same way with the other websites that I follow. They are being updated on an hourly basis, I can tell you. Immediately, we have our PIOs, Public Information Officers, that will immediately jump and put the latest information. And we need to, because it is evolving, and it's evolving quickly.
Because you've had personal experience. I mean, Los Angeles has had some pretty devastating fires very recently. So you've had personal experience. Do you wish more people had been part of that alert system so that they would have been able to be evacuated earlier or be given information earlier?
Absolutely, absolutely. Now, we do have the wireless emergency alert system, which basically we can geofence an area, send the signal. Every cell phone within that area will receive our signal, will receive our message. But having said that, you can only use that if it's a fire life safety situation. So if we need you to evacuate immediately because the fire is approaching your neighborhood, then we can use that. There are very strict FCC guidelines to how to use the system. So Notify LA, what it does is that it allows us to send any kind of messaging, educational messaging, or to give you the heads up. Listen, there's a fire, but it's 10 miles away. It's approaching. Please be prepared. So definitely, they need to please sign up. And if you go to our website, it'll tell you how to sign up.
Okay. And just what should we have in our house? Because as I said earlier, I was somewhat joking. There's a run on toilet paper, which is completely baffling. But what should we have? I mean, I would imagine it should just be almost what we should already have as an earthquake kit, to be knowing that we might have to be on our own for a couple of weeks.
Well, first what you need to do, you need to sign up for the RILAN, which is the Ready Your LA Neighborhood program. I'm not sure if you're familiar with it. That prepares you for any kind of emergency. It's not just this one. And if you look at the frequency and magnitude of disasters globally, not just in Los Angeles, it's increasing and they're very severe. The 17 out of the largest 24 fires in our history was in the last 2 years, 24 months. So you need to prepare. So definitely I'm going to preach RILAN here. We have emergency coordinators ready for you. You can reach out and you prepare at the community level. The first responder is a family member or your neighbor until professional help arrives. There's only so many first responders, police, fire, who are second responders in a major earthquake, because again, truly, if something happens to you right now, who's helping you? It's either Joanne and me or me, right? And then help will
Both
arrive.
of you.
Both of
Not
us.
or, and.
Yes, and. So we need to take that extremely seriously, and I'll give you the second part of that question.
I would say, at minimum, have your medications, for sure. This isn't the time to, I'll pick it up from the pharmacy. You want to have at least 30 days ahead. And you can talk to your doctor, let them know I need an extra prescription because I'm making my emergency pack. Have a bottle of water, have enough food at least for 3 days, at least, while you're waiting for those first responders to come. So you're looking at, non-perishable things, dehydrated things, canned foods, something that you can easily prepare.
I say 7 days.
Okay.
72
He's the
hours, yeah.
expert.
I say 7 days. That's more realistic.
Yeah.
So I want to thank you both for coming in today. I wish we had met under different circumstances, but it's really nice to know that Los Angeles is as prepared as it is. So thank you both very much.
Thank you.
Thank you for having us.
And that's it for this edition of LA Currents.